Hey, Off-White Coat listeners, it is my privilege to get to tell you about this sweet deal from our friends over at Picmonic. If you haven't heard about Picmonic, it is a fantastic picture-based mnemonic platform that can certainly help out any student. Most of the videos are around 2 minutes long and provide a quick and effective way to memorize material for any upcoming medical exam. It is extremely efficient. They have this search bar function where you can search playlists on general topics like renal to step 1 to step 2, or even first aid and other books. If you want to review the Picmonic for later, you can even make a playlist of your own. Picmonic even has this repetition algorithm that is spaced out according to your learning needs. This helps with increasing long-term retention and allows you to review the right information at the right time. One of my favorite functions is the quizzes that are associated with each Picmonic. I'll take the quiz first and then learn about the associated pictures and what facts I need to sharpen up on. Honestly, Picmonic is a fantastic tool, and if you use our code OFFWHITECOAT, you'll get 20% off. That's Off-White Coat with no spaces. So what are you waiting for? Make studying the easiest part of your day. Sign up with Picmonic and use Off-White Coat to save yourself some money. Hello everyone and welcome to the Off-White Coat podcast. I am Jordan Abney and I am joined today with Dr. Andy Veras. He is a resident at Jersey City Medical Center. I got to do some rotations with him and now I'm getting to talk to him right now. And so we started this whole thing just so I could showcase a little bit of the emerging medical talent that's coming in. And this guy is top notch.
Oh my God, thank you. I mean, you're being way too nice. Thank you.
Andy, he was super helpful during my rotation. We had some good times. I actually learned a lot. Andy, when I was in my rotation in IM, was first year.
That is correct.
Resident,
yes.
Right? Yeah. And then now you're second, right?
I am.
Moving on up.
Yeah, halfway through. We'll see how it goes.
How does it feel being not in the intern year?
It feels honestly wonderful. I mean, you have way more responsibilities. At the same time, you have to watch over your interns. But it's nice not to be an intern. Feel like you're moving forward, becoming more independent.
Oh, I bet.
It is quite challenging, but quite nice as well. And can be scary as well, but in a good way.
How are the new interns?
Honestly, some of them remind me a lot about myself. They're really nice and they're really, down to earth and very polite. I mean, you see that they also are struggling to learn the system and to learn how to do stuff, and they feel bad or frustrated when they don't do things right. But at the same time, we encourage them, hey, we've been there. You're doing fine. You'll learn the system. And keep pushing through. So honestly, yeah, they remind me a lot about myself because they ask a lot of questions I would ask at the time, and I'm like, wow, they really not know how to do this at the time because you're just so, let's say, insecure about what to do about certain situations, even the most simple things.
It really comes full cycle when they're asking you the same question.
Honestly, it feels nice. I wasn't the only one asking those questions back in the day.
That's a good thing too, because then you feel you won't get frustrated when people. Is there anything that you do get frustrated with though when somebody has asked you? You're really nice. So
yeah. Oh, thanks. You're really nice too. But honestly, not really. I mean, honestly, I don't, because I've been there and everyone learns different in a different manner. So you'll see people that get the hang of the system in 6 months. For some other people, it might be a little bit longer. I felt like it took me a little bit over 6 months as well. So it's it is what it is, and I'm just here to help and support as I can. So
how was adopting I guess because when you're talking about having to learn the new system, it must have been very difficult for you because you came from the Dominican Republic,
that
right?
That is correct, yeah.
Yeah, so had you ever been to the U.S. before?
Yes.
Okay.
Yeah, so I only did a 1-month observership back in Charlottesville. That's in UVA, and that's the only U.S.-based experience that I had back in the day. So it is quite a change because you come here, even the thought process here is different and what is expected of you in the first year. So it's you have to adapt to this mentality and all that, and it doesn't happen overnight. So definitely, yeah, it can be, adapting to the system can be challenging, but it's so rewarding as well.
You had to adapt to not only the system, but the culture of being up here.
Exact. Oh my God, yeah, and this cold weather, yeah, back in the DR, this weather doesn't exist. So all that, living alone, coming here, but you meet a lot of really nice people like you, for example. So
hey, thank you. Was there anything that you have like really loved about being in Jersey or like close to New York that you didn't like expect or anything like that?
Honestly, well, you already mentioned it just there. So yeah, honestly, what I like about Jersey City, these areas like, you know, it feel like that city vibe as well, with a young population as well, and it's close to the city, but it's not as busy as the city. So to be honest, before I applied to this program, I mean, I applied to the programs to the Veras platform. So I'm like, what is Jersey City? Because I didn't know pretty well. I mean, New Jersey, for me, I don't know very much like of different places in United States, other than, for example, DC or New York, or Florida. So it's like, wow, this is really a nice area. I mean, it's really cold, of course, but it's nice, and being like close to the city, it's also a big plus.
The cold has been affecting me as well.
Really?
Like I was not expecting it to be as cold as it was last year.
Really?
Or like just the snow staying. Because I'm from Georgia and then I went to Grenada, so
oh my God,
it was just, you know, not a lot of snow in either one of those places. Yeah, the cold is the one thing that I don't like, but all the other stuff, just being close to the city and just exactly like you explained, like because it's not as like the hustle and bustle of the city, but you have like you're still looking at it. It's beautiful views.
Honestly,
you can't beat it. So you've enjoyed your time in Jersey City. Did you know anything about Jersey City when you moved in?
Absolutely not. I mean, I even came to the interview, and I remember seeing New York after I finished my interview. Back at the time, we were doing still presidential interviews. This is 2019. And I'm like, wow, this is a nice view from this place. And I'm like, wow, what is this place? Because I'm like, I just remember I was staying in Englewood with a friend, so I just took an Uber here, and I just stayed for the interview, like, real quick. But after I came also to live here, I mean, you know, there are some nice areas and some not so good areas, but overall, it's a really nice experience, and it's very diverse as well, and I've learned a lot about different cultures, eating different type of foods, without any gastroenteritis yet. So fingers crossed we'll keep it that way.
Yes. There's an Asian market that's right near it's the closest grocery store, that 99 Rand.
Yeah.
Oh, I've gotten to get so many different foods and learn new things. It's actually been great. Just because you would normally buy like whatever but they don't have like normal chips and stuff like that. So you're buying new snacks.
Exactly. They have all like an Asian names, the scriptures. I'm like, what am I buying here? So it is interesting, to be honest.
And then it's like really good too. You're like, wow.
That's true, and really
like a
fresh.
crab cracker. You're like, oh, let me see what this tastes like.
Yeah, and they have interesting desserts as well. I'm like, oh, this looks nice, and they're really nice, to be honest, so far.
So how was the application process? Because you, I guess, were living in the Dominican Republic at the time. So when you were applying, did you just apply to like schools or places that were in like big cities that you had even heard of? Because you said you only had been to Washington, D.C., right?
Yeah.
So you were just like, I know Florida, I know Texas, or, you know, New York, New Jersey.
Yeah, so basically when I applied, I mean, I honestly don't know yet a lot of the geographics here in the U.S. Like, where is that place, for example, or this city or that place. But basically how I applied, I first narrowed down the programs. Like, for example, I'm on a J1 visa. So I just narrowed down who would take like IMGs, number one, then my type of visa specifically. And then basically it was kind of, let's say, like a hard process, like tiring, because I went to the portals of most programs, not all of them. And I looked like, oh, let me see the requirements, because some of them ask, for example, like a specific time rotating in the US. That, for example, thank goodness with St. George that they do an amazing job with that. And they ask, for example, let's say research year, 1 year rotation, or have you done this or that, or specific cutoff for the scores, and all that information. And basically, and also the graduation time as well. That is something very important. I mean, I only had like 3 years of graduation after I finished. But some of them have a cutoff of mostly after 5 years. So it's like, I know a lot of people can get an impasse because of that. But basically, so I narrowed down, I went to the portals, and I applied to the programs that I consider I would be a good candidate for. And I went from there. I didn't apply to all of them, though, because you find programs that you say, like, oh, maybe I wouldn't like going here. Or, I don't know, like, maybe I don't have enough money to apply to all the programs as well. So
yeah, that's the thing too, is it's so expensive to continually apply.
Definitely.
So you said after 5 years there's like a cutoff, so you don't
usually, well, Not all programs, but you'll see like in their portals, like, oh, so usually we don't take persons that have 5 more years after graduation or have like a big gap that is unexplained. I mean, if you were doing something on that process, let's say you were doing research or you were working actively, for example, or rotating, they can take that into account. But if there's no like an explanation, some programs can filter you. I mean, you can still apply. I know people that have gotten into programs way more after 5 years. But yeah, you have to have like a good explanation.
That makes sense. Yeah, it's still like that. But I'm taking that gap year too, so I have to like find.
Oh, but listen. You have a lot of U.S. experience. You're great. I'm very proactive, and it's only gonna be 1 year, right? So,
yeah, it's only hopefully.
Don't worry. No, that's nothing. You're gonna be good. Don't worry about it.
What did you do? You said you had 2 years though before you got into residency.
Yeah, so
from graduation.
Yeah, so basically, I think it was, let me see, I graduated 2016, basically. So yeah, it was 3 years.
Okay.
But basically, I only applied back in 2019 because back in our country, so it's not as easy for us to take the steps because we're not taught properly how to think, for example, since the beginning in that way. Now we're trying to implement that. Well, not me. The universities back in Santo Domingo, how to think more clinically since the beginning.
Yeah, it's like thinking how you're going to answer this question.
Exactly, yeah. The first time I did, so for example, I started with the Cuban for step 1 and I was like failing it so bad. I was like, wow, what am I doing? But it took some time, and then I took the exams, and then I applied. So for me, it took some time to prepare for the boards, for example. So that's why usually you'll see that some people come from other countries usually have like a gap after graduation, maybe because of that.
So did you do anything interesting during that time, or were you just studying? Did you travel? Did you? I don't know.
Interesting. Oh, so the first year after I finished med school, I did like a 1-year internship. So in my country, in order to practice, you can practice as a general physician, but you have to do like 1 year like of rural service. You can do that in big hospitals as well. So I did that, but it was like a little, let's say, it took a little bit of my time. So that year I didn't study much. And then I began studying after that. After that, I basically dedicated myself to study and doing some research because I found out that I like research. Not the data gathering, that sucks, but like, doing research and finding cool stuff and publishing stuff that is pretty interesting. And I also travel from time to time. I came here, for example, to visit my sister and do that rotation as well. Go on vacation. That's why I've been to DC a couple of times because my sister used to live there for some time. Now she's living in Pennsylvania. So yeah, that's what I did. And then I applied, and here we are.
And then here we are.
Yeah, I was blessed enough to end up here. So
yeah, it really just takes one shot, really. Were you applying in those 2 years, or were you just like studying, getting everything in order?
Yeah, basically I was just studying. I just applied one time when I applied to the match, but that year, basically, those 2 years I was studying for step 1, then CK and CS, working on research, and that was basically it. Then I applied, hope for the best, and here I am.
So this is a question that I've asked a couple times, but is there anything that has made you like grateful or glad that you went? You came from an international medical school, or you came from the Dominican Republic, and now you're here. Like, do you feel like it gives you a leg up in a certain way, or do you feel happy that you did it?
Honestly, I feel really happy that I did it, and I'm grateful to be here. I mean, every day sometimes I can lose like sight of that because it can get a little, let's say, busy in the hospital. You get lost like stressing about stuff. But honestly, I'm grateful I'm here because I feel like I not only learn a lot about myself, because you learn a lot about yourself, living by yourself, experiencing other places and cultures, but hospital-wise, the way you learn how to think, for example, how to act and the independence you get, and like in a place that could be more equipped than other places you could go, with high standard of teaching, it definitely makes me feel like really grateful.
That's a really good answer.
Oh, thanks.
Yeah, so we've already talked about your applications and everything. Did you always know you want to do internal medicine?
Honestly, no, I didn't at the beginning. So when I went into med school, I was more into surgery, like neurosurgery and all that. But then, actually, when I took that class, like neuroscience, which includes neurosurgery, I realized it was like too much. I didn't like it. And honestly, then I said, maybe general surgery. But in the hospitals, I didn't enjoy it as much as all of my peers. And then when I did internal medicine, people actually tell me like, oh, based on your personality, you could do something more like patient-oriented rather than surgery. And I began like exploring that possibility. And I realized I like internal medicine as well. Specifically, for example, I like cardio among some of the areas. I mean, I like other areas. But yeah, so I realized that internal medicine is where I belong, where I feel more comfortable.
Are you you said you were interested in cardio and stuff. Are you planning on specializing or doing anything like that? Or?
Yeah, that's a good question. So yeah, honestly, I'm planning to do cardio maybe. So we'll see now if I apply. I'm not sure if I'm going to apply next year because basically for fellowship, you apply at the end of second year. So internal medicine is 3 years. So you apply at the end of second year because then you interview in December of that year is when they tell you if you match or not. So it will be basically next December if I apply this July.
Oh, okay. So yeah, you would have to apply this July just to see if you, okay.
Exactly, yeah.
Do they still look at like all of your grades from your step and everything? That's what I've heard. Or you have to at least put those things in, right?
Yeah, so some people say no, some people say yes. What I do know is that they look at the step scores and they also take into account if you passed or failed step 3. And if the specialty is like competitive, they can even take into account the step 3 scores. That's what I've heard. Oh. It's not like confirmed, but it will make sense that they could use that to differentiate a cutoff and all like that. So,
well, if anybody is in part of a fellowship or cardiology team, you need to hire this man. He is great.
Thank you. I wish.
Yeah.
So nice.
In 2 years, maybe somebody will be listening, and then they can be like, "Oh, I've heard of that guy."
Maybe. Yeah. Oh, that would be amazing, to be honest. Jesus.
Yeah, that would be amazing. Unfortunately, unlikely.
Yeah.
Were there any challenges that you thought, that you didn't think were actually going to happen during your first year? Did you have any unexpected challenges?
Okay, so let me see. Challenges?
Besides adapting and doing all that other stuff.
Okay, so let me see. Aside from adapting,
or I mean, yeah, you could still use that one, but you had just said that one. That one's honestly, a tough one. That's way tougher anyway than I can imagine. Wow. But
yeah, honestly, let me see. Challenges in first year is basically dealing, with as time goes by, there are expectations, and at least for me, it's a challenge as well because usually when I was a med student. Yeah, it's like, there's always someone above you, but even as a PGY1, you're responsible some of the times for things.
Yeah.
And it's like at one point you are expected to be allowed to make your own assessment, do things without direct supervision from your second year. And yeah, at the beginning I was anxious, especially before second year, midway through first year, because you will see the PGY2s making decisions on their own for the patients. I mean, because they were being indirectly supervised. So it's wow, this is going to be challenging. So adapting, knowing that at some point, sooner than later, I will have to be the person in charge of making decisions on my own for the patients. Yeah, it could be
1 more year.
Yeah. Oh my God. Yeah. Even the thought about it, some people say it's exciting, but for me, it's wow, really? I'm going to be on my own after I finish. I'm going to be the boss in some of the cases. Can be intimidating though.
Oh, certainly. Is there anything that you, they expected you to do in your first year or something that you hadn't even learned in medical school? Some kind of procedure. They're oh, do a radial stick. And you're
Yeah. So usually, for example, at least in my country, we try to have a hands-on experience, but there are things they expect you to learn here. For example, do insert triple lumen catheters and all that. And it's maybe I did a few back in my country, but I didn't know it's I'm doing internal medicine. It's something clinical that I really have to do procedures, what is going on. But yeah, so learning those procedures, knowing that you have to do it, and sometimes they're important to decide patient management. Yeah, so I was unexpected that you will have to do that sometimes because, especially in the US, everything is let's say the functions delimited, for example, this person does this, and this. But yeah, there were some procedures the midlines as well. We don't do them as much, but some of us are expected to know how to do them in case no one is available to do them and the patient needs, for example, IV antibiotics because they don't have peripheral access or whatever. So yeah, it could be...
That's when you got to rely on the nurses. And you're oh God, I don't know how to do this.
I'm so basically what I do is I'm oh, did your charge nurse try it? She says no, I'm crossing my fingers, please let the charge nurse get the line. So
have you ever seen the show Scrubs?
I have.
Yeah, like in the first season, I remember there was an episode, it might even be like the first episode, but I thought it was like the best representation of like hospital, like the intern, like that life when the nurse is doing all the lines for the guy and she's like, don't worry. She calls him some buttercup or whatever. And she's like, I'm doing it. And then the attending doctor actually knows. He's like, he like rips on him at the end. He's like, whenever you get the nurse to stop doing all your procedures. And he's like, ooh.
Oh my God.
Because, you know, you're like, I don't know. He has no idea. He's like running around back and forth from the hospital, barely making it.
Oh yeah, exactly. That's going to be usually the intern year at the beginning. It's like, that is like, when I was, for example, on floors, I felt like I have no idea what is going on with my patients. You don't even know. So you're going to learn also that each attendant, for example, have their own way of thinking or doing things. So they can expect different things. So you must know how they think. So you feel like you're going to be out of place. Like that character in Scrubs, for example. At the beginning, most of the time, like you're bouncing and not learning anything, but you're learning passively even if you don't realize it.
That's true, yeah. Presenting to an attending and doing all that, that was nerve-wracking for me, even in my, like, rotation.
Yeah.
I can only imagine, like, in your first year, too, I was like, oh.
Yeah.
Because it depends on their mood, who they are.
Oh, my God, yeah. There are people that will scream at you out of no. I mean, you're going to have different personalities, people with different moods, so usually people will scream at you for no reason, and they'll be, oh, why didn't you tell me this? And there's always something that's going to slip away because there's only so much you can write, especially when you have multiple patients. Yeah, I remember the first time as a student when I did my rotation, my observership here, and also when I presented initially, it was like nerve-wracking. It's like, I'm going to have to call like a specialist or something. It's like, do I really have to do it? Then it becomes so natural, but still.
Did you do your rotations in the U.S. or did you do them in the Dominican?
Oh yeah, I did all of them. While I was in med school, I did most of the Dominican Republic, all of them basically. The one I did was like, it was a rotation, but in papers, it's an observership. That's why I call it that way. It was actually like a rotation-ish. But I did that after med school. Thank goodness there are those options for when you don't realize, because at the moment when I was in med school, I wasn't like sure I wanted to come here still. So it's like I didn't like put an effort to rotate outside at the time.
Do you know where you want to work in the future? Like, do you want to work in the U.S.? Do you want to go back to the DR?
Yeah, so I think I want to work here. Initially, when I came in, I'm like, oh no, I'll go back to DR, because usually when you're on a visa, you do like, basically, you either go 2 years for your country or you do a waiver. So I'm like, no, I just go back 2 years to my country and decide from there. But honestly now, I'm like, no, I think I'll just stay here and do the waiver.
Do you have to continue? Okay, so you have to continue to renew the waiver?
Like, basically, you do the waiver, which is like waiving your right to return to the country. Then I guess I can apply to I don't know how that works exactly, but after that, then I can apply for residency here, like for papers and all that, and all that stuff, like to be I don't know.
And then you need a work visa, I guess.
Yeah, in the meantime, I will. So I'm guessing that wherever I go after that, they will sponsor me as such. Like
when you sign the waiver, you're signing off the rights. Oh, because if you go back, do they pay?
Yeah,
for some
so basically,
okay,
so in that case, so you can do two things. You can do 2 years in your country officially. They will pay us an attending there as well, and then I will come back here looking for a job and apply. And whatever, or I can just sign a waiver, like waive that right, and go to what we call here underserved areas. But they're not really underserved. I mean, people find waivers in New York. It all depends. There are more options for people that do not have a visa. But basically, you will sign a 3-year contract with a place and do what we call the waiving right. That's what we call the waiver, and do it in that specific place.
That's what I was even thinking of doing something similar, where you go to an underserved area and you pretty much work your loan off.
Exactly.
Yeah.
Oh yeah, I've heard they pay way more. So people, for example, find that attractive because they pay way more. It's a little bit quiet. Some people like that too. Maybe at some point in my life, though. Do you see yourself like living in a quiet place or a busy place?
I think that I definitely quiet later, but there's something about the busy and a lot more crazy stuff happens in the hospital. And I feel like if you learn everything you can in a quiet place, that's great, but you can't adapt well if things get busy. Now, if you learn everything in a busy place and you can go to a quiet place, you can be like, oh, okay, like I'm comfortable working at this pace. This is easy. And then if things pick up, you can just resort back. If you're trained in fire, you're going to be way more adaptable than...
Definitely, and it's easier to go like from hard to easy than to go the other way around, so...
And that's why I kind of think that as much as I don't like the cold, there's a lot of trauma and stuff going on up here, so... Is there a place that you want to live specifically in the U.S.? Would you want to live up here, or would you want to go somewhere like warmer?
Honestly, based on the weather, maybe somewhere warmer like Florida or California, to be honest. But honestly, I know, right? But at the same time, I don't know, I like this place. I mean, I don't know if I would if I would be able to stay living here, for example. But I like the vibe of this area place, like with the city vibe and all that, at least for the time being. So yeah, definitely maybe I will think somewhere warmer in the future, depending on how things go.
I mean, you'd fit right in Miami for sure.
Definitely.
The only thing is you wouldn't get to stand out. That's the only thing. Everybody speaks Spanish. I'm going to Miami just to learn better Spanish.
Really?
Do family medicine.
Nice.
I have like a family medicine rotation, but my Spanish, I used to be decent with it when I went to Peru and Ecuador in college, and then I didn't use it for like 4 years, and then I came working in the hospital.
Oh no!
And so I was just like, I was like trying to remember everything. I was like, I need to go back to Miami. I'm gonna be like doing Duolingo on my phone. Trying to. So it's gonna be a crash course for sure. If you had to pick one place outside of the U.S., would it be the Dominican to practice medicine, or would it be somewhere else? Would you go?
Wow, that's a question.
Yeah, because
wow,
you're from the Dominican, so it really is. Yeah,
interesting. So
I didn't know if you want to go like Switzerland.
Oh my god, that's a really good choice. You know, I really like. I mean, I've been to Switzerland, but I read about it, and then honestly, yeah, it looks like an amazing place. They have amazing chocolate. Seems like very well.
I have heard that. I've never been there either.
Oh, nice. Yeah, definitely. I had a friend of a friend that went there like for school at one point, and he was like, "Oh no, this place is amazing. It's so organized, and it's in Europe." So honestly. But I wouldn't say, honestly, I haven't thought about a place I would go outside of the U.S., for example, to practice medicine. I'm about to put some thought into it, but Switzerland.
Because you wouldn't want to go somewhere that it would be too chaotic, where you don't have any resources. But,
exactly.
You know, actually, Switzerland might be, they seem like they'd be very organized. They'd have at least all the medicine.
Exactly.
I was in IR this whole month in a rotation,
nice.
and the lady that is the radiology tech, she was talking about how, and I think it was definitely the European countries, and I think she was talking about maybe like Denmark, Switzerland, some place like that. But she was talking about how there's like the vascular surgeon and all the equipment they have there is like superior to the one that we have in the U.S. She was like, oh, really? They're like years ahead. I don't know how accurate that is, so don't quote me. I probably shouldn't be saying that.
No, it's okay. Don't worry about it.
But,
I mean, people will advertise themselves, so who knows? Maybe it's true, maybe not.
Yeah, but she was just like, oh, they've got all this. I was like, man, I didn't even know they had even more technology than we have now.
Interesting.
I remember when I was doing my IM rotation, they had the COVID floor. Essentially, like the 7th floor was just like half of it was only COVID. The other half was normal. And then they had the rest of the hospital kind of quarantine. Is it still going on?
Yeah, sadly it is. I haven't been in the hospital since I was in clinics. And before that vacation, I was actually in the ER, by the way. Oh. Pretty nice. But yeah, so they've been telling me that 7 East is full-blown COVID again. That they've been getting like, you know, the rapid responses we were getting for patients like because having problems because of COVID. And ICU again is having some patients here and there. Mostly are unvaccinated though, the ones that are like having like severe symptoms. So the vaccine is, you know, actually works. But yeah, it's full back on. At one point a few months ago, we only had like maybe 3 or 4 patients in 7 East in that area where it was the COVID area, and 2 or 3 in ICU. It is now going up again, unfortunately. The thing is now a lot of patients also are COVID positive, but most of them basically come for another complaint and they incidentally test positive.
Is there anything that you could have in the hospital right now that would make your life easier? Like, I guess you haven't been on the floors though. You know, I was about to say like with this outbreak or even just now, because now the hospital is like packed.
Yes. It's like super busy. They even opened the overflow team because they're like swamped.
Yeah, I'm like, what does the hospital need to make it run more efficient? Maybe not even run more efficiently, but help in the fight to...
In the fight for COVID, let's see. I mean, first of all, we need more availability of rapid COVID testing and all that. Like more testing available. Also more personal. Now, you know, we're having like the shortage of nurses around some areas. Because of the COVID thing and the travel nurse thing, so it will need more of that. More residents also will be nice to have, and have basically as well a bigger hospital because we're like busy all the time. It's like sometimes we're not enough. Well, at least they're now expanding the emergency department, So they're supposed to like to have a little bit more beds available as well, like the RDU area.
Okay.
So it's gonna bring a little bit more of extra beds, I guess.
That'll be good because a lot of the patients are in the ER that the internal medicine teams are taking care of.
Exactly.
Because there's just not enough beds in the actual hospital.
Exactly.
The nurses is bad too, though, because in IR, like all the nurses are gone too.
Really?
I don't think it's because of the vaccination stuff. I think it's for other reasons, but even still, there's only 2 nurses. One's like a half, even in that department. But if you can imagine, like on the floors and all those, that's so. And I remember at the other hospital that I worked at, or that I was doing OBGYN at, the clinic that they had, because of the vaccination rule, they lost like 9 different nurses. And there's only one lady. There's 2. There's 2 ladies that were allowed to stay.
That is so
And then
sad.
the manager or whatever. But so 3 ladies, 9 had to leave. Like having to replace all that is tough.
It must be a nightmare. I mean, especially then, at the beginning, teaching new personnel how to get a hang of the system takes time. Not only happens with residents, but happens with everyone that comes new to the hospital. So it must be really sad.
Do you think it would be better to rapid test at the hospital? Like when you say that we need more rapid testing, do you think it would be better to get those rapid tests to the hospital or to like different organizations scattered around the community to give the rapid tests?
Honestly, for both, because usually, so in the hospital, I think so far we don't have a shortage yet. It would be nicer to have like more in general, because I've heard that around the places we're getting like, for example, if you go to a testing facility right now, like a pharmacy or something, they only have like 40 available per day, which is basically nothing. And everyone here is having also, we have the flu laying around. So if you have COVID symptoms, you want to get tested to know if you can expose someone or not, right? And it's like, it's really sad that you're exposed to someone. You want to go get tested, but maybe you have to stand in line for like a lot of hours and not get tested at all. So definitely both guys gather them around, first of all. And also in the hospitals, like equip them properly. Also from the personnel as well, so we can have access to, as we have access to employee health, I believe, will be easier to get more access to it, like to get tested should you develop symptoms, even though you might not have COVID, because anyone can have COVID at this point. So
yeah, I thought that was an interesting thing too, because I was me being a student, there was a couple times, or like Mary Beth was just feeling a little ill like a couple weeks ago. And I wanted to get tested, but the ER was so packed. Yeah, and I felt fine. And it even seemed like she just had like a sinus infection. But I couldn't, like there was nowhere to go. I couldn't wait and if you notice that the City Med and all those, like the lines are packed so long.
I'm like, no way I'm doing that line.
People are going to the ER to get their rapid test.
And it's sad because then in the ER, so for example, what is happening in some places is that most of the patients in the ER are turning positive for COVID. Like at least half of the patients, even though they're not here for COVID, but it's like it's so laying around. You might get COVID in the ER. Exactly. You might go to the ER to get COVID tested, be negative, but surprise, you were just exposed to someone next to you that might have had COVID. So,
that's something to consider. Anybody, like if you're going to an ER to get COVID tested, and I guess anybody that's waiting in any line to get COVID, but in the ER, you're going to be in a closed environment.
Exactly.
It's a good way to spread it. Unfortunately, I feel sorry for all the ER docs, but it's definitely.
Oh my god, they're wearing like N95s the whole time now. You know how annoying those masks can be.
Yes. Oh my god, and just getting enough of them because they always disappear. It feels like the box is just one day you know where a box is, and then you go and check, and then it's gone.
Exactly. Yeah, it can be really hard to get a hold of those. I mean, right now they have have it in specific places only, so people can go in a regulated manner to get them, because if not, we can run out of those masks.
Yeah. I think that there needs to be more rapid testing at places like City MD or something like that. The only criticism I would say to that is I've been to them a couple times for my COVID swab, and like I always get, if it's not in the hospital, like an ER nurse will shove that thing all the way until you bleed. And then they'll just pull it back. Like every time I've done that, I've felt like I just
went
like,
into your brain
had
or
my
something.
brain
Yeah.
picked,
Oh
yeah.
my God.
And then I go to like CityMD or something like that, and then they'll just like do the lightest rub, roll out, and then I'm like, okay, which I tested positive one time by going there and them just doing the lightest rub.
Okay.
So I was like, okay, so I guess it does work. But
Yes.
I was like, man, you know that you're getting the full effect if you're going, because they will unapologetically pick your brain.
They will go. Last time I did the testing before I came over from DR, I actually like cry a little bit. Like my eyes got teary. It's like, oh my God, what are you guys doing? I'm like, well, thank goodness this is negative, because after they did it, probably got into my brain or something. It was like really bad.
The first time I had ever had one, my mother's an ER doctor, and we had to go get tested to come up here, and there was all this like blah blah blah. So I run by the ER real quickly. We're about to. I'm one of the nurses comes out, and he's about to like do it, and he did it. This is like right at the very beginning. He went so far. He's like, oh, I think I went too far. Because I felt it like rubbed the back of my throat, and he's like, oh no, he's like, that was a good one. I was like, yeah, you did.
No.
Oh no, I mean, he definitely did it right or whatever, but he was just like, he's like, I got you that time, didn't I, Jordan? I was just like trying to hold back the tears.
Oh my
like,
God, I would have been like loosening in there in the chair. Oh Jesus.
And he's like one of my friends that's like my age, and so he's like, gotcha. I'm like, yeah, it wasn't that bad, and I'm like, tears are running down my face. I was like, because you're trying to look tough. You're like, that didn't hurt at all.
This is a test. Yeah, I've done this before. Oh my God, I'm so sorry. That sounds like traumatic.
Yeah. Are there any restrictions that they put on you or on the teams or anything due to COVID?
Let me see, restrictions.
Or I know in the cafeteria you can only sit one person to a table from now on. I don't know. You haven't even been in the cafeteria recently, have you?
Yeah, so
because you've been in clinic and stuff, right?
Yeah, they do have restrictions, like for example, to certain areas now, like for I think ICU, but for the ED, if you're gonna go down to see like an admission or something, N95 is mandatory, for example. They're also restricting again the number of people. You know that also they have in the rooms like signs, no more than 4 people due to COVID. Now they're trying to make those things again a thing. And obviously we're hanging around with masks. I still don't know if the COVID unit is not yet like we call like airborne yet, because all the rooms that are like negative pressure are not filled yet. But at one point it could turn again, like back in December.
That's how it was when I was.
Oh, you remember, right? Like the half of ICU was like a closed COVID unit.
Yes.
It was so annoying, like wearing N95 the whole time, because it was literally laying around in the air.
It actually was a beautiful blessing, because the ICU and the CCU, what they told us, like as students, because there wasn't enough N95 like a year ago.
Yeah.
They were like, we don't want you going down there at all. So when you're there, just take those weeks off.
Oh my God.
And so I had, I think, ICU and CCU, but it was the ICU. I went to the CCU rotation because eventually it calmed down. But the ICU rotation, I remember I got COVID that week. So I didn't actually have to like return and go extra days for being sick, because on those days that I was quarantined, those 2 weeks that I was on that rotation was my quarantine.
Oh my God. Yeah. So it worked really nice for you.
It worked perfectly.
My God.
And then it was funny, because then I was having to give like the vaccine. They were making us give the vaccines right after that, because this was like New Year's of that year.
Okay.
And so everybody was like, hey, how was the vaccine for you? And I was like, I don't have it.
Yeah.
And the fear in people's eyes, they're like, wait, what do you mean? I was like, I'm a skeptic. No, I'm just kidding.
Yeah, it's just
because
you
like,
have to wait like 3 months. Oh my God, yeah. I remember, you guys were given the vaccine at that time. I also one of you guys gave me the vaccine as well. Really nice. You guys were doing a good job.
We were gentle.
You guys were gentle. I mean, the side effects with the booster were horrible, but yeah, you guys were gentle.
Did you have side effects from the booster?
Yeah, so let me say, with the booster, I had to take the day off the day after the booster, because I couldn't even get up from bed. I was like weak, feeling like abdominal pain, general malaise in general.
Did you have any symptoms after the first 2?
Yeah, so after the first 2, I remember I was actually CCU in that rotation, so I felt like a little flu-like-ish. But it went off as the day went by.
Okay.
But the second dose was only like severe arm pain. I got Pfizer, by the way. But the third one, it put me out of commission for a whole day.
You got Pfizer for all 3?
Yes.
Okay. That's very interesting because there's another student that she felt like a little weird for the first two, but the booster wrecked her. Like she
Really?
thought and then everybody got COVID around her. She was just like, did I actually have COVID at that time? Because she was wrecked after. She was like the next day after, she was just like, you see the bags in people's eyes and they're like all super tired. And then you can just tell, you're like, what's going on?
Yeah.
And they're like, oh, and you're like, oh goodness, you weren't expecting that with the booster. I thought if anything, the third one you'd have the less.
I agree with that. It was like the other way around. And for me and many people, I know many people in my hospital that had to take off as well because of the booster. But we have to do it, especially with Omicron now.
The thing is, supposedly, with all the different, if you've gotten it and then you've been vaccinated and all the things, it's supposed to create, at least some immunity.
Yeah, the lethality is way less. Thank goodness.
Oh, it's interesting because I thought about this the other day with another student, but I wonder if the people, because you said like the people that are unvaccinated, the ones that are going to the hospital have it more severe. I wonder if they're more severe because they have Omicron or if they have one of the strains, whether it be Alpha, Delta, that they're not vaccinated for. And Omicron's still a lighter dose, but because it's not as effective on the vaccinated, that's why you're seeing the vaccinated show up with Omicron and it be lighter. And then like if you're unvaccinated, you're not protected for anything. So you could get Alpha, Delta.
Honestly, yeah, that's a very interesting thought process. I mean, right now what we are seeing is that the people are getting like more severe COVID. I don't think we're like testing for specific strains.
No, yeah, we're never testing it, so it's only like a mind thought more than it is.
We're basically thinking things. It's like the predominant variant now, and it's like way more people are getting it in spite of the vaccine, most likely. But the people that are getting like sicker and ending up in ICU needing intubation are people that are like not vaccinated, basically.
Yeah.
So there's definitely there, but that's a really good question. Are we getting the original COVID, the bad one? Or only the Omicron one? Hopefully it's the second one, right? Because honestly,
it's amazing how much it has affected everything just in the past couple years. I guess it's been 2 years now.
Yeah.
Is there anything that you would say to like any of the students listening or anything that they could do to prepare themselves for their first year? Because we were talking, there's a lot of stuff that you don't know, and you're going to learn on the job. But, I was thinking the other day, it was about like being sterile. That's something you can learn, like maintaining the sterile field and stuff. That's something you can learn as a student that is really, really beneficial once because they're going to expect you to know it.
Especially when you do like those sterile procedures you would do even as an internal medicine or whatever specialty you choose, for example. So that's a pretty good skill to have and dominate as well. Always to keep hygiene as well is really good. So things I will advise the students, for example. So number one, like very important, enjoy time before residency because it can get really tough. People told me that I wouldn't believe it. I was like, yeah, I'm glad I did enjoy it as much as I could. Number two, try to take step 3, like to study for it as soon as you can. Because, for example, in residency, some residency programs expect you to take the exam before a certain point in time. So especially if you, for example, some people are going to other specialties that are not like, let's say, touch a lot in the step 3 exam, can have difficulty like grasping the content and all that. And also to know that this is it's a marathon, not a sprint. Some people get the hang of the system first and you will get frustrated, but you're only gonna keep pushing forward. And also if they want to do like a specialty or something like a fellowship, to basically prepare for it, like since the beginning, try to mentalize yourself and try to decide what they want to do, because depending on how competitive a fellowship can be, it can take some time or some research or some, let's say, curriculum that you need to prepare beforehand, all while you're in residency.
I've heard about that, yeah. Like, especially if you want to do cardiology, you need to have your ducks in a row on cardiology content before you go around saying that you're going to do cardiology. You don't want the attending to ask you a question about cardio. He's like, oh, he's going to cardiology. Let me ask him a question. Exactly. And then you not know. Yeah. That's really, really good advice. Did you ever make your first doctor purchase? Like once you got a little bit of money, have you made that yet?
Let me see. I mean, nothing big and stuff. I mean, I got the iPhone, for example. I felt like a doctorish, the iPhone 13. They feel doctorish. Other than that, I haven't purchased like anything big. Like
Still waiting on that Maserati or whatever you're thinking.
yeah, that will be when I'm an attending at some point.
There you
But
go.
yeah, definitely something like that will come.
Yeah, that's an
later on.
attending purchase. That's not a resident purchase.
Definitely,
a Maserati.
yeah.
That's not a. That's not one you.
Not at this point. Yeah, no, with the rent prices, depending where you're living, of course.
What would be one of the things that you like your best and your worst things about residency so far? Like, I guess, what has been one of the things that you've really enjoyed being a resident as opposed to being a student?
Okay, being a resident. Okay, so I like the independence you get, the responsibility. It's both scary. I mean, it can be a pro and a con at the same time, because sometimes you can be like, oh, I'm glad I'm not the person in charge. That's nice. But like being a resident, you feel like you're growing, like you're getting to the final stage before you go like full in professional life. So I like the responsibility, be able to take things more seriously. People will also take you more seriously because you're like now a doctor and you make decisions, you put orders in the system, for example, like you prescribe medications for the patients. So those type of things, they're rewarding and also feel like, like you're learning but also making a change in people's lives. But you also make that as a student because, for example, in your case, you were helping us a lot back in the day, being proactive, presenting patients, speaking with patients. So
there's definitely a jump though because there's sometimes when people hear that you're a student, they're like, oh, okay, like,
oh yeah,
I don't have to put my problems on. He doesn't know what he's talking about.
Yeah, but definitely, as a student, you have less responsibilities, and that can be a plus. But as you advance, I mean, you become more confident, and you push through in spite of, in my case, in spite of the little anxiety that can come, like, oh my God, I'm almost there, or I'm the person responsible for this. You just push through, so that is nice. Things that can be hectic, the schedule. I mean, for example, you're expected to be there. Let's say you're supposed to leave at 6:30, but you have a patient that complicates at 6 or a complicated admission. You stay, I mean, you can leave if you want, but it doesn't feel right to leave and leave like a patient that is supposed to be under your care while it's not stable yet. So it's like there's a weight of responsibility that can take a toll on you emotionally, physically. And also you have like I said, there are more expectations. So that can be a little scary, and it's not like something as a student you'll be like, man, I miss being a student because of this. And also dealing with a lot of things that you don't maybe see as a student, like social working, people screaming at your face and like, calling you out for things that maybe are not your fault, but you're the resident. So everything can be your fault at one point.
Mm-hmm. It's definitely a bigger burden, but there's something to that burden that it's more fulfilling.
Honestly,
I feel like
it's really fulfilling. Yeah, you will feel that your work is meaningful, to be honest. Actually, that's like a question you'll get once you're a resident, like in a poll that ACFMG does. Is like, and also like whatever the organizations that oversee residency programs, it's like, oh, do you feel that your work is meaningful? And you'll see that you can fill that question like properly, because even though you can get caught in scout work sometimes and some other stuff, you are doing meaningful stuff and changing people's life by just interacting with them and also treating them. Sometimes you'll be like, hey, why don't we do this for the patient? Or I think the patient has this, and surprise, it is that. And it's like, wow, I did that. So it's really fulfilling, to be honest.
That's awesome. Is there anything that sticks in your head where you've done something like that? Where you...
Let me see, yeah.
Where there was an attending that was wrong and you were like, hey, sir.
Honestly...
I'm just kidding.
Yeah, no, but you will see, for example, usually that's why you always do your own assessment. For example, one time I was back in the emergency department. I will never forget this patient. She had what we call methotrexate toxicity, the medication for rheumatoid arthritis. So she came here a week before, but like in the ED was discharged. She came back this week, and she's like pancytopenic. And they're like, oh, this patient has pancytopenia. But then upon reviewing the chart and looking at the whole assessment, it's
stomatitis, like, pulmonary fibrosis.
Yeah, and honestly, no, she didn't have that yet, but she did have like the pancytopenia, was taking her medications not properly. Turned out she had kidney dysfunction. So basically based on not her taking the medication properly, she had like pancytopenia. We had to call the pharmacist to get the leucovorin and all that. It felt good, like being in charge and like, oh yeah, this is happening. I think the patient has this is happening, and then finding out, confirming your suspicions, or doing like, for example, stuff like you see like, oh, this patient will need intubation. We have to intubate right away, like stuff like, Like feels fulfilling, like challenging, but at the same time it's like, yeah, this is happening because of me, and it was like the right step in management. I still haven't had that moment like, no, you're wrong. But I have sorry. I have had COVID. This is allergic, by the way. This is not COVID.
That's what he says now. Now that he's on.
Oh my god, you're not really scared, are you? You're just joking.
I'm just joking.
Okay, no. Yeah, so basically, but I did have, I have some friends, for example, in residency that had like, I think the patient has this, and it eventually turns out to be that thing. So it must feel like really nice to be part of the, to be taken into account, because in, I don't know, in some countries, you could feel like maybe your thought process is not taken into account. But here it's like, they actually ask you, what do you think? And you're like, do you really care? What do I think? Or something like that. So it is really important.
That's a good way to think about it. Is there anything that you wanted to say? Do you have anything to plug?
Honestly,
any cardiology specialty would be a blessed to have you working for them. So you need to consider that if anybody's listening.
Definitely. Thank you. First of all, thank you for having me here. It's nice for you of wanting to have me here in your podcast. Thank you for making me part of this. This is honestly feels pretty nice. And I hope anything I said can help people at some point. But yeah, and what I have to say to anyone listening there is like, this is not easy. Residency stuff. The process is not easy either. It creates a lot of anxiety. Sometimes, for example, you go interview and you just sit and wait. It's like, I've done everything I could. What do I do in the meantime? Sometimes you just wait and try to prepare for the next step, and try to take your step 3 as well, and just push forward. And know that you will meet people that will try maybe that will make you feel a little down sometimes. But because of things that happen, frustration, everyone is tired, high stress environment. But know that it's part of the process. You're not alone, and we all push through eventually, okay?
That is a great way to end it, for
all
sure.
Right.
If anybody has any questions for Dr. Veras, or I pronounced that right?
Yes.
Yeah. If anybody has any questions or would like any contact, you can contact with us at offwhitecodepodcast@gmail.com, or you can find us on our Instagram at offwhitecodepodcast. We will be streaming from pretty much every service you can find: Apple, Google, Spotify, even all the obscure ones. So please check us out, subscribe. Yeah, and we'll have to get you back on. Maybe we'll get some updates once you're a third year or something.
Oh, that would be awesome.
Once you're in charge.
Definitely will be nice seeing you again, honestly.
Yes,
we're going to miss you this few months while you're someplace else.
Yeah, I've just been bouncing around everywhere. But dude, yeah, thank you so much. And thank you everyone for listening. Bye.
Bye.
Hey everyone, I want to take this time to tell you about our friends over at TrueLearn. They have this top-of-the-line test bank that is perfect for any upcoming board exams that you may have. They have test banks for all types of exams. So whether you're studying for medical school, nursing school, OT, pharmacy, and others like speech pathology, TrueLearn is the way to go. If you're like me and going through medical school, they have question banks for all the big exams, like Step 1, Step 2, and Step 3, with quality assessments for each exam. Look, I know we didn't go into healthcare because we love taking tests. This is the hard part of the job. Make it easy on yourself with TrueLearn. Sign up now with the code OFFWHITECOAT to get $25 off your purchase. That's OFF white coat, no spaces, to get $25 off your purchase. This is a test bank that you do not want to pass up on. Make this easy on yourself. Take the deal, pass your boards, and get back to enjoying the reason you went into healthcare. And make sure to use Off White Coat when you pick it up.